Mayor, we are eagerly awaiting that stimulus bill, which does have some funds earmarked for state and local governments. What is key for you in that aid?
What is key for my city and parish is certainly making sure that the citizens of our community can have the gaps closed that exist for them. And that means the healthcare gaps, that means the access to food, employment, and making sure that our citizens in our community can stand up during this time of the pandemic.
How much of that aid also needs to go towards vaccine distribution?
Well, absolutely. I would certainly say that a significant percentage should go towards vaccine distribution because that is the pathway for us getting to the new reality or back to some normalcy. I will say here in our city, we have been collaborating, and we found that those collaborations have strengthened the fabric of our vaccine distribution by working with our state partners as well as our local area hospitals, our nonprofits. We are now over 1 million vaccines here in the state of Louisiana.
There has been just some logistical challenge talking about these vaccines, getting them to more rural areas, given the deep freezing mechanisms, the two-shot doses. Of course, the J&J vaccine over the weekend, that news was encouraging, given that it doesn't need those deep refrigerated levels. Are you hopeful that that will help improve some of the vaccination rates, and particularly some of the rural areas?
I'm absolutely hopeful. And I will tell you that here in Baton Rouge, our focus certainly is on making sure that access takes place in the underserved communities of disinvestment. And we have had a successful rollout so far in that we are taking the vaccine to areas where the underserved are. We're taking it to them. For example, I just left a press conference in my city where we are rolling out 1,000 vaccines this Saturday at a church. And so our faith-based community has been an integral part of making sure that the underserved community is served with the vaccine because they're part of the fabric of our community. So, you know, we had that icy snow weather that's disrupted the vaccine supply to Louisiana, but we're now moving it out very strongly. And it is definitely imperative that we close the gap of access of health disparities in our underserved community. We did it with the testing. Now we have to do it as we roll out the vaccine.
On that note of this equitable recovery, what are people on the ground, businesses on the ground telling you about a post-COVID world, what that looks like, how it can be equitable so that we can all participate in the recovery?
You know, we actually started that conversation last year with our local businesses by promoting programs that help sustain them during that time. And so our businesses are part of the encouragement of asking people to get the vaccine. They're our partners in this process. Most recently this week, we started our Health Equity Vaccine Task Force, which is made up of a number of individuals from the medical community, the business community, grassroots community, faith-based community. And our goal is to remove those obstructions that may exist and to develop a comprehensive strategy so we can continue to encourage people strongly to get the vaccine and make sure, more importantly, that we have it and that it's accessible.
From a financial perspective, what stress are you feeling on the budget from deficits, from a loss of revenue, any cutback in services that you have to do?
Well, you know, I've always said that local budgets, local municipalities were not designed to absorb a pandemic. So my city has been very efficient in terms of how we have operated during this time of the pandemic. Fortunately, I will say because of our efficiency, we have not had to furlough any of our employees. We have almost 4,000 employees here in city parish government. We have not furloughed or laid off anyone. So we have been very strategic We have been very responsible as we have operated in this pandemic, recognizing that no city budget was designed to absorb a pandemic.
Yeah,